Right now, a warning from health officials about RSV. Respiratory illnesses among children are surging, and it's putting a strain on some hospitals now. NBC's Gabe Gutierrez has the details.
Doctors and nurses nationwide sounding the alarm over an unprecedented rise in respiratory illnesses among young children. Nearly 75% of the country's estimated 40,000 pediatric hospital beds are now full. Connecticut Children's Hospital in Hartford is in touch with FEMA and the National Guard about putting up a medical tent in its parking lot. Other hospitals are also stretched thin.
The majority of the children are coming in pretty sick. They're requiring higher levels of oxygen that they normally would require.
Respiratory syncytial virus, or RSV, usually causes mild cold-like symptoms, but infants and older adults may develop severe infections because their lungs are weakened. At Yale New Haven Children's Hospital, there are now more than 100 RSV cases in the emergency department. That's nearly double from just a week ago.
Have you ever seen numbers like this before?
Sure. Definitely not as high as we've been seeing them now. And I would also say from over the years, just like the acuity and how sick the kids are is much higher than it's been ever in the past.
Doctors say this may be the result of young kids having relatively little exposure to other viruses during several years of COVID.
A lot of kids just haven't seen RSV, and then now they're seeing it for the first time all at once, and it's leading to a big strain on our hospital resources.
In Columbus, Ohio, Shanasty Ireland is keeping watch over her 2-month-old son, Asa, who just came home from the hospital.
It was a big struggle for him to get a breath of air.
His diagnosis, RSV.
If you've seen a child in that kind of distress with that labored breathing, it's the most terrifying thing as a parent because you're completely helpless.